problems of healthcare, of the illnesses that of people are suffering. You talk about like the environment, the place we work, or the food that we eat every day. So, but you know, I also think about like mental illnesses that I didn't hear about I didn't hear he talked about it in the presentation. So because human mentality, health is really important. That plays, you know, significant role, you know, to shape the physical body of people. So I think it's also one of the upstream points that should be included in the upstream problems that you talk about.
Mental health is a key part of the Alma Ata Declaration. Social health is physical, it is sociological, it is psychological, it's political, it's cultural.
Yeah, so usually we go to a clinic or a hospital, though. So the doctor just asks us. Usually they just ask us like, they just check for the visible symptoms, and what they just do is cut up the top of the tree, and the root is still there, and so that's why we just suffer from the illness over time again and again. So they never look up to the upstream problems.
Correct.
I don't know if the doctors in U.S. maybe they have some special treatment and special investigation on the patient on that points, but in Vietnam it's not really really happen.
Yeah, so An, you're making a good point, and I want you to bring these thoughts into your breakout room, because health is not just for the hospital. So maybe a doctor can't address all of the upstream factors, but the speaker in the TED video, he mentioned how he works with like building inspectors or people whose job is not necessarily health, but those upstream factors that impact why you go to the clinic are very important. So how can we look at a partnership in Vietnam between many actors, not just the hospital, not just the doctor and the patient, many actors, and say this will create a healthier Vietnam.
Right. Yep.
Very good. Well stated. And it's not just professionals who are the actors. Principal actor is the family.
Yeah, informal caregivers.
And that's what we were talking about last week, the importance of caregivers and carers. And that's what Bending Bamboo is interested in as well, the bilingualism of a family and multi-generations. Some of the most important work that the professor that the Gunto 7, the master students had the last 8 weeks, his work is in the development of family medicine, family science, to address a very large percentage of health issues, even before it gets to the health clinic, and then the hospital, and then the health officials. They're almost the last level of engagement in some ways. You always need their support, you always need their authority, but the key actors are at different levels.
All right, I think we can jump into the PowerPoint now, Dan.
Okay. And Liz is going to step out and head down to the faculty college so that we're at least represented. Bending Bamboo has to be represented at it. Did you want to say anything before you cut out on health?
No.
Okay.
I'm not ready yet. Okay.
All right, here we go. Again, for those who didn't get the news last week, we finally have our contract with IEEE Smart Village, and their first payment is expected in Ganta by Wednesday of next week, which is welcome news. So we now include them in our masthead. Forum 8, our second week on health. So I want to review very quickly, but as An suggested, let me take any questions you have on the 4 principles of SEED. SEED comes out of the book that you see here to the left, Empowerment on an Unstable Planet. And SEED is an acronym: self, evaluative, effective, decision making, SEED. And it sets the stage for scale. Scale is a term, a concept in development that has multiple definitions, but it means basically seeing SEED work at a community level. And then at a higher level, communities teaching communities. And at a higher level, a government, ministries of a government, taking that good evidence of communities teaching communities and turning it into policy. And at a higher level, countries teaching countries how to create global policy. So SEED is the foundation, it is the basis. And on that basis, you grow different levels of scale. The 4 principles of SEED are that a community should begin with what it is already doing well. It builds on its success. It builds on its assets. It needs to hear and needs to know that it has done things well for a community to even exist. It has done something well. Otherwise, it would not exist. Second, a community can continue to build on its success, on its assets, on its wisdom, if it taps into valuable partnerships. And the partnerships are with outsiders. So Katie, Liz, Dan, Future Generations University. We are outsiders. We're not Vietnamese. But we have a strong connection to insiders. And there are 2 important partners inside of Vietnam. You especially. I think of all of you as educators in Ganta and the Delta. You're not elected officials. You are not the party chairman. But you are also not the grassroots. You're not at the bottom. You are what I think of as the grass tops. You're at the top of the citizenry that is engaged and invested in education in the Delta. And so that's an important partner, people such as yourselves. The next important partner are the authorities in DOIT, in MOIT, in corporations, in the 100RC network, the rectors and the presidents of the universities. These are people with authority. So a 3-way partnership is something that is top down, bottom up, and outside in. The 3rd important principle of SEED is that we move forward step by step with data. We are not making decisions simply on the basis of our ideas or on ideology or on politics. We are making decisions instead always on the basis of data. So we've been very careful since the first workshop to collect information and surveys and opinions and ideas. And we try to do that as well, even in the teacher forum. That's why Katie sends you things and collects your information before each class, after each breakout session, and we will have a very thorough survey at the end of our 10 weeks of the teacher forum. So data matters. With data, we do research. With our research, we are analyzing and synthesizing. With that, we write a narrative of what we have learned. And we take that narrative forward and we share it with others and get them to be part of our Bending Bamboo educational endeavor. The 4th principle is that we are, as well as our students are, open to behavioral change. If one is opposed to all change, then you don't even need education. You don't need Bending Bamboo, and you don't need to be part of a teacher forum. But it's our assumption that everybody is open to behavioral change, and your change is going to be based on data, and it's going to be enriched by good partnerships, and it will build on the success of what each school, each community, each teacher is doing well. So those are 4 principles of SEED. I'm going to come out of the PowerPoint and share my face and ask if you have any questions or comments or critique or suggestions. When I think back to our very first workshop, so this is even before Katie was with Liz and me, when we gave the first workshop at Namgunta, some teachers asked, why do we need to be talking about any principles of development? We are just teaching English. So at this point, 2.5 years later, is there any question why it's important that education is held together with some development principles? Go ahead, too.
I think different from other discipline, education have different way to communicate to people, because we really care about the age groups. We really care about their background, and also most of the individual around the world will have really intimate connection to educator, especially their teachers. So the younger they are, the stronger the connection can be. So that's why most of the kids going to school coming back with all of good advices. It's just like they need someone to listen to them, and we can set up that kind of change from there instead of waiting until you have qualifications or degrees. So if the family can change that kind of like nurture most of the behavior like that, so in the future you don't need to educate them a lot, because most of the basic things starting from the family level. That is, I'm strongly believe in that. And one more thing education can do, like when you include the content, it's like the Bible. Most of the people believe in most of the inputs at school, but they doubt a lot when they are in the society. Anytime you see the poster around, you will have more questions than trying to get the value from it. But at school, it's a different way. At school, people appreciate the value of, the transmission from the teachers to, the audience over there. So that's why I think education is strong rather than other discipline.
Yeah, that last point really resonates. We often think that learning occurs on the school ground, but think instead of the community as being the school ground. Think of the country as being the campus. Let that be our 24-hour-a-day learning environment. And while there are particular kinds of learning we can do on a school ground, there are other kinds of learning that we can do 24 hours a day, 7 days a week, if we take the community as a very good place to learn. That's why we're building Bending Bamboo on the context and the content of the Delta. It's not just coming from a school. That's why we want every chapter to begin with the profile of somebody in the Delta doing things well. Those are our teachers. And we want every chapter to end with the profile of a school that is learning well, which means it is taking its learning into the world and putting it to good use. So every chapter, every grade level of Bending Bamboo instills the confidence that we can be learning everywhere, every day, all the time, with everyone. I just came up with a new slogan. Okay. All right, let me continue. Back to the PowerPoint. So we monitor and evaluate whether we're doing seed well with 5 questions. Are we doing it with equity? That is, does everybody benefit? Both rural and urban, different levels, teachers and students, administrators alike. 2, are we doing our work with sustainability, which includes economics, culture, environment? Are we doing it holistically, which means that all aspects of the community and of Bending Bamboo advance together? So we have 10 chapters, we have 10 subjects. Can we think of all 10 topics moving forward together? 4, interdependence. And that's going back to the importance of partnerships, is the interdependence of stronger relationships growing step by step. And then I think the 5th part of monitoring seed is maybe the most important. We do not worry about doing our job perfectly. Rather, step by step, let's just get the job done and know that there will be another cycle. And we'll do it better with the next cycle. And with the next cycle, it'll be better and better and better. That's what we mean by iterative steps. So we have 2 workshops a year. We want each workshop to be better than the last. We want next year's workshops to be better than this year's and last year's. We do 10-week online teacher forums. We want each semester of teacher forums to be better than the last. And how do we do that? We do that by really studying your comments, your input, your surveys, and studying with the data, what did we do well, what can we do better? I do want to get Bruce's drawing of the Bending Bamboo curriculum done before Dr. Sun arrives this Wednesday. He'll be in Washington, D.C. He'll come to Future Generations for 2 days. And I want to be able to present this to him nicely done when he arrives. It's not the end of the world if we don't, so we don't have to be perfect by Wednesday, but it would be nice. So the comments I've received from last week and during the week, we have to change our picture of identity, maybe to Nola instead of the water buffalo. Our people on the motorcycle need to be wearing helmets, otherwise everybody is in violation of the law. And the suggestion is shape this as a map of Vietnam, or somewhere in this indicate that it's Vietnam. Right now, as you look at those 10 topics and as you look at the words Bending Bamboo, it isn't necessarily Vietnam, unless you really know that, that is the Jim Blackbird in the middle there for culture. So we need a clear indicator of Vietnam. So send Katie, send me any further suggestions you have on this right away. So Bruce has a couple of days to turn it into a new banner. We will hang this banner beside the SDGs. So we've got the cultural, the particular, the Vietnamese version of what we're doing, and we have the universal UN-driven SDGs. We need to know a storyline, somebody who is going to be able to illustrate holistic health. All right, and we need photos, interviews, profiles of not only 10 people, 1 for each chapter, but also eventually 10 schools, 1 for each chapter. We need you to point out to us who is a person in the Delta who is an excellent example of someone practicing holistic health. And holistic health, again, I gave you the story of community data versus big data. We talked about that much of last week. So a holistic health practitioner in Ganta on Campus 1, when I had my full body rash, was a student. So the person who is the best example of holistic health might be a student, might be your neighbor, or might be a famous scientist. These people are models of holistic health, but we want somebody who is from the Delta, not from TED. And we talked about this community in Sardinia off the coast of Italy as an example of holistic health. But give me an example of holistic health, where, who, how, profile whom from Ganta. We also talked last week about Alma Ata, and that it is about the right and duty of people to participate individually and collectively in planning and implementing healthcare. And to An's point, healthcare is practical, scientific, and social. And we need to be clear about our methods and our technology for demonstrating the practical, scientific, and social parts of health. In the first paragraph there, you see from the Declaration of Alma Ata, which really was the launch in 1978 of global public health attention. It says, health is a complete physical, mental, and social well-being. It's not simply defined by the absence of disease or the absence of an infirmity or your access to drugs or hospitals. It is a complete physical, mental, social well-being. I'm going to jump out of screen share because that's a very important point, and it was the basis of your question before we started today. Any further questions on that? Or comments? Katie, they're going to have a lot to talk about in breakout session because they're holding it in right now. Back to the PowerPoint, and I'll be done very shortly. So, who, how, where, what? We need a profile of somebody demonstrating this approach to health. Those in the master's program with Manju, you studied social determinants of health, SDOH. Share that in your breakout session. How all of this is interrelated: the neighborhood, the environment, the healthcare system, the clinics, the hospitals, but also social, community, commercial, context. The fourth part of SDOH, education, formal, non-formal, lifelong, and perhaps education through bilingual families. And one of the most important determinants of health is economic stability. A family that is economically unstable, and that might be because they're poor. It also might be because they're not poor, but they've lost their security. They've lost their stability. So they now live in uncertainty. Or it may be a family that has wealth, but it's now in the middle of a war. So there are many aspects of economic stability, instability, that determine whether or not a family and individuals in the family are healthy. We looked at all of these different metrics. They're fun to play with. I corrected this one. This is about Vietnamese male ages 15 to 49. And the biggest social determinant of health here is how they drive their motorcycles. And can they avoid cars and trucks hitting their motorcycle? We looked at the MPI, the Multidimensional Poverty Index, which combines health, again, with education. Education and health are so closely linked, and the standard of living. The MPI is valuable because it is something that every community, every high school, every junior high school could actually be a determinant of health. It's a very simple survey. It's a yes or no survey on how to be part of measuring the multi-dimensions of poverty and health. And we looked last week at these health data from Vietnam on those things that cause death or premature death, disability, and premature death and disability in Vietnam. Okay, and that we looked at last week, so I won't read through that again today. And we ask that you wrestle with these questions. Can bending bamboo ensure improved health? Where else and to what depth do other classes on the high school campus, the junior high campus, at your place of work, at the university, at the language center, where else and to what depth are people addressing health? To An's point before we started, is it the job of the health clinic and the hospital to teach health? Everything I presented this morning and seed scale would say no. The health clinic and the health hospital, they are part of a very complex portrait of health. Many determinants of health, many actors helping with health, many caregivers, carers, teachers, modelers of holistic health. And what role can bilingualism play in this discourse? Can bending bamboo augment the learning objectives and other disciplines on campus? So, let me make sure there are no further questions about the 4 principles of SEED, because that's part of what you're going to be discussing in your breakout session as it applies to health. Can I answer any questions?
All right, and if you do have questions, you can always message me to come into your breakout rooms, and I can help somehow. Does everybody have their work from last week? Do you have your seed scale work from last week? Ian, I see you're unmuted. Okay, Yin has it. Who was in Yin's group?
Yeah, I mean, wait, sorry, wait a minute. Okay, let's check. So, I think Namis the two.
There's 2.
Thu Võ, I don't know. Hiếu, Hữu Thọ, Sen.
Okay. So I'm thinking, because we don't necessarily have the same mix of people this week, that most groups didn't get to 3 and 4. So we'll spend our breakout room time on questions 3 and 4 of the assignment, which I'm emailing you again. So you all have that in your email, the assignment. In your breakout rooms, work on questions 3 and 4. And if you have time, go back to 1 and 2 and see if your mind has changed on what you would have answered before. But because we don't have the same people as last week, we'll kind of just work in different groups. Does that sound okay? All right, I'm going to throw you into breakout rooms. You have the assignment, and you're working on questions 3 and 4, and you're also identifying somebody who can be the face of this unit, the profile. Okay. Go ahead. Click join breakout room.
Tonight, the video we have. But Katie, can you remember one video we share where a place they eat gạo lứt muối mè? The home rice?
Oh, yeah, brown rice.
Yeah.
Where? In Gantha?
Yeah. I remember we share one video for that.
Yeah, it was Amtup. But they closed their restaurant in Gantha, but they only served a macrobiotic diet. So only brown rice. They used like a special soy sauce. So, and their child, they wouldn't feed their child like any other food to see if that would like produce a healthier child.
But they closed?
They closed their Gantha store or restaurant, but they have I think they have a restaurant in Ho Chi Minh City, and they have a small store on Mao Tun Street, Mao Tun and Batanghai. It's right there, like right next to Highland Coffee, I think, right there.
Mm-hmm. I think that is a very good story to tell about.
That's a good idea. Yeah, I'll write that down. I am still in contact with one of the people who worked there, so I'll reach out to her. And they give like presentations on their diet and why it's healthy. Let me.
You have the telephone number of the owner or someone working in that?
Yeah, I'll send that info to you. I'm friends with her on Facebook.
Mm-hmm.
But yeah, what about, let me pull up, can somebody screen share? Or, sorry, I had to restart my computer. And now I need to find the assignment. So 1 second. Did you all get through the questions 3 and 4? Yeah, okay, good. Okay. Okay, I'm curious about what you said for Principle 3. List 5 indicators of health that anyone in Vietnam can look for to identify if someone is living a healthy life. What did you say? Just a regular person, if they're kind of looking around, how can they tell that the Vietnamese are living healthily? I'm curious. What did you say?
Well, I think a normal person, they can look at appearance. First, they can look at appearance of the people, of a person, like look at the skin, look at the facial expression, body reaction, or even the happiness level.
Mm-hmm.
Or they can base on like working or and living environment and the habit to assume the how healthy a person is.
Mm-hmm.
And also look at the visible symptoms or behavior analysis, the behavior change of the person. Yeah.
What about, is there a conversation in Vietnam about how habits are changing and maybe in an unhealthy way? Like behaviors like what kind of food you consume, what kind of exercise you do, or if you do exercise. Are there any like worries in the conversations happening about like bad behavior changes? I think about all the milk tea that's drank and all the sugar in that.
Yeah. So
yeah, go ahead.
So you're talking about like eating habit and living habit.
Yeah. Are there
have,
any changes like as Vietnam's rapidly developing? People have more money to spend and like they're spending it in all these different ways. Maybe some of those ways could be negatively impacting their health. Could you think
yeah.
of ideas
Well,
like that?
the main source for illnesses is from food and what we drink and what we eat form who we are and how healthy we are.
Mm-hmm.
So it has tremendous effect to our health, and I think that's also related to mental health. Because for example, like if you drink dasor, that contains a lot of sugar, and it can boost up your mood right away after you drink it. maybe 5 minutes or 10 minutes, but later on, it's gonna make your body even worse. If you are stressful, then you are more stressful. But
Mm-hmm.
at moments you drink it, the sugar will boost up your mood right away.
Yeah.
So
Yeah,
it's
no, sugar highs are, and like,
yeah, for long term, it's gonna make your mental health become worse.
yeah. Do you
Also
know if
physical.
there's a rise in, what is the form of diabetes that you acquire? Is it type 2 diabetes or something?
Maybe, yeah.
Is there a rise in diabetes among, I would think, especially children? When I would drive around after school is letting out and you see all the food vendors outside the school and they're just sugar everywhere.
Yeah.
Which is, I mean, that was a problem is a problem in the US. I was listening to a TED Talk, because I always do that. And they said that when you walk into a US supermarket, only 25% of what is in that supermarket can be considered food.
Mm-hmm.
Everything else is manufactured and processed, and it can provide no nourishment to your body. So like, and that's, I mean, walk into Big C or Sun City and you see kind of the same thing. Everything is packaged and processed. What kind of nourishment is that actually bringing to you? Another question I have is, a lot of people have office jobs now, and with the Vietnamese work ethic as well, you work 6 days a week usually.
Mm-hmm.
I mean, how does that impact health? Like sitting in an office 8 hours a day, 6 days a week. Yeah. Does anybody feel that strain on their health?
Well, I think it's I can represent for that situation because if you work as a teacher, you can move
Yeah,
more
teachers.
often than me. Yeah. Um, you know, if you sit a lot in a day, then the rates, the possibility for deaths. I remember like we have higher possibility of death, like maybe 40%, I guess.
Mm-hmm.
Not exactly, but I just remember like 30 or 40%.
Yeah.
And also it uh, affects a lot on our heart. We have heart disease, like, and also
Yeah.
the blood pressure.
Mm-hmm.
Well,
Exactly. You need to be moving to keep your blood flowing. Yeah, Truk, go ahead.
I found an article on Consumer Health Report. It talking like sit less, move more. This is the most recent issue.
Yeah.
Yeah. So they talk about how many hours is okay to sit. If not, there's other health issue.
How many hours can you sit and be healthy?
Those who spend more than 6 hours of their sitting are more likely to die from heart disease, diabetes, cancer, stroke, and liver disease, and others.
It's not about how many hours you sit in a day, but how long each time you sit. Like if you sit for
Time,
an hour, then you move around for 5 minutes, then it's okay. Otherwise, you sit for a whole 8 hours per day. There's a lot of risk.
Yeah. Yeah. And like, I mean, if you think about a farmer who's always moving around, like they're the epitome of like a actual human health. But maybe at career fairs, we don't value your health when you look for a job. You value what kind of money you can bring in. But what if we like looked differently at what jobs we seek? For example, me, I notice that I'm working so much on my computer right now and sitting so much, and that's not me. I would rather get paid less and have a job where I'm active.
Yeah. So the farmer will never worry about how fast they are because they usually move to work. but they have more risk like pesticide exposure. So yeah. So every child
So
has.
that brings me to my next question. What did you say for principle 4? How can, what did I say? How can other people change their behavior to help all of the Vietnamese achieve better health? So our choices impact somebody else's health, whether that's like driving our motorbike a lot or buying a big car and like it produces a lot of emissions and people have to breathe that in, or if we want really, really cheap food and we don't care how that's produced, that can affect the farmer, it can affect the factory worker, and then it can affect your child that you're feeding that food to. So I'm interested to hear from other people, what did you say for principle 4? What behavior changes could Vietnamese people make to help all of Vietnam achieve better health? Hugh, what did your group say for principle 4?
Okay, we talk about something. Maybe we make a list of about we should encourage people with a healthy blend diet. Yeah, and so that they can continue to keep good health, and they can have them keep their good chef. And the second one is Mr. said that is the physical improvement. For example, to try their best to keep fit and stay healthy. And the traffic stress, maybe did not use. We won't use more model or car. We just use some mentally friendly transportation, I think. And the last thing, we must a list of environmentally friendly product using. Less of using a lot of products that is not good for the customer.
Okay, so environmentally
reducing
friendly.
Using it as a group things of this. Yeah, but we did not find is a narrative or a story about this. Mr. asked me to continue to dream up is tonight.
Yes. Meditate on it. Think about
we think of vegetarian restaurants only. Yeah. For example, Bát Thảo. Bát Thảo. This is a vegetarian restaurant for us to come to eat. A lot of good food there.
Good. I like those ideas. Did anybody come up with an idea for who could be in the narrative? Any people who you think of in Vietnam who's like, that person is healthy. Their whole person is healthy. Ooh. Okay, well, yes, meditate on that.
Can stay healthy, but not at the chef.
Can we interview Ang for a very bad example? Because he's a workaholic. And then from there, we brainstorm something good for the whole.
All of you are workaholics.
That is one thing I think people should change, because we bring home a lot of work. It's not like some of my friends, they never work at home. They work hard during 8 hours, 10 hours in the office. But then when they go home, no mobile phone, no work contact, no business discussion. I think that behavior, that good for the whole community to change.
Yeah, that's a part of mental health. having separation where it's not that you feel that you have to wake up at 3 a.m. to answer a text message, but it's okay to stop sometimes, to take a break, be with the people in the room. One of the TED Talks I didn't send to you was about social interaction, how social interaction prolongs your life, and not necessarily virtual. It has to be face-to-face, in person. But yes, so meditate. Yeah.
I think that is a thing I learned from the information on TV. That's foreigners try something called a simple lifestyle. For example, they don't want to build a large house or use a lot of modern facility. They just use something have many times to take care of themselves, including in minds and their health. How can you remember? In Vietnam, they say sống tối giản.
What does that mean? Can you translate? What is sống tối giản?
I heard that there is a term like minimalist lifestyle.
That's what I want to be.
But it's very hard because like when I think that I need to buy something.
Yeah, that's right.
I have to think a lot of and think if it is necessary to buy it or not.
Well, yeah, it's really hard because in the modern world, we are raised to think, I need it, I buy it. I need this, I need this. It's more that you want it, you don't necessarily need it. And then it has taken me a really long time to change that habit. But now I go into a supermarket and I only go to the vegetable section. I don't go into any other aisle because, I mean, for example, I clean with vinegar and lavender oil. I don't use any other cleaner. I use rags. I don't use paper towels. And this is all American stuff. It's crazy how much stuff you can buy here. But it's definitely difficult because our behavior, we are trained to buy. We are trained to consume. Trained. We are trained.
You know, whenever you... Go.
Go ahead.
You're talking
different things. Just like pot, you have like separate one or cook different thing. When
oh my gosh, I know.
Like one pot or two pots, and then knife, you have like 12 different knives for different function, different use. When you
I want to do a fun example with you really quick. Sorry. Okay, so for example, this is funny because this is what I'm living right now. I am in my uncle and aunt's house. I'm house sitting. That's a thing here. And I'll show you their kitchen. So that's their kitchen. And like, whoa, there's 5 stove tops. There's like 1, 2, 3, 4, like 20 cabinets. Just so much stuff. And I don't know, it's 2 people. It's 2 people. I don't understand why they need everything.
I think that we should like stop stopping the Facebook or watch TV commercials. Because they only encourage us to buy something that we don't need. For example, exactly. Like I already have a table, but I see on the television that the commercial that this table is much cooler. So I decided that should I buy it? And then it urged me to go to the shop to go shopping and buy it, despite the fact that I already had one, and we don't need. Yeah, I don't need that table.
Yeah, my theory is that most of the things I need already exist. I don't need to buy something new. There's sometimes an exception, like a computer, but I can buy a used computer or something like that. But yeah, it's Anvi, I'm sure, do you feel a conflict because you work at the television station?
Yes.
Yeah, go ahead, Anne.
I got a suggestion for everyone, especially for food, for food and drink, what you consume every day. So to prevent that you buy more than what you need, what you really need. So my suggestion is that you should take some time to learn about some substances, some kind of chemicals, substances that they use in the food or your drink. And when you go to buy it, let's have a look at the ingredient. Actually, they will not show everything in there, but you will understand somehow whether it is good for your health or not. So that's not 100% help, but I believe it's gonna do great help to prevent you buy things more than what you really need, and also you buy something more healthy for yourself.
Yeah, generally, if it's not packaged, you have a safe bet. Generally, sometimes vegetables have pesticide residue, but we don't know.
Right, exactly.
But yeah, being aware, because it is your health. Like it's cancer, it's diabetes, it's something, you know, like if you don't think about it, you don't know what could happen. But so we are out of time. I think this conversation was really good. Again, I'm amazed by how fluid our Zoom, not only is it Zoom, but it's in English, on health. It's great. Intercultural. It was a good conversation. Thank you. So next week is that our last week? Yeah. Next Friday is our last forum. We're going to talk about food, water, energy, how those three things connect. Yeah, I'll send you another good TED Talk. So get ready.
Thank you.
All right.
Thank
Bye,
you.
everybody.
Bye.